So here's a picture of the eyeball. And in the eyeball, basically what's happening is that this is the cornea. And so this is the clear window of the eye. We need tears to cover this collagen structure. This is one of the reasons why we develop dry eye when we're not able to get the coverage there. And then, of course, behind the cornea, this is where the anterior chamber, and this bathes the lens of the eye. And we'd like the lens to be white like this. When we develop cataracts, the lens begins to become discolored, like brown. And this is metabolic waste, free radicals. And part of the issue is there's no circulation that runs directly into the lens. So it's very vulnerable if it's not getting enough nutrients that cataracts will form. Now, we also have people ask me about narrow angles. So this is kind of the entryway where the fluid kind of circulates throughout the entire eye. And when you develop glaucoma, there's either an issue with the meshwork here, so there's an impediment in the fluid, or you're not producing enough fluid in the eye, which creates a starvation, especially here in the optic nerve. And the optic nerve is really important to protect if you have glaucoma. And I'll go into how you can do that in a minute. This is the posterior chamber. This is the place where the floaters live. You know, those squiggly, spirally, very irritating specks that start to form. And this is a collagen filled gel sac. And one of the reasons why floaters begin to grow is because this particular gel sac begins to shrink and dry out. There's a diagnosis that's very common called posterior vitreous detachment, PVD. And it means that the vitreous is coming apart from the retina because it's shrinking. This sometimes can lead to things like macular pucker, because the macula is one of the places where the vitreous is attached, and macular pucker is like a wrinkle in the macula. So we're going to talk more about the floaters because most people have them. Just to continue, we have the retina here, which is the place that captures the light. And by the way, we're going to do some color therapy this morning, which will boost the photoreceptors. And then finally, we have the optic nerve that goes back to the brain. It's kind of the fiber optic pathway that sends the electrical impulse from the eye back to the brain, and that's how we see.
If you like this video, hit the subscribe button and turn on your notifications. Please send your comments to me. I'd love to hear from you.